Welcome to the Derm Vet podcast, where pet skin is always in. I'm Dr. Ashley Bourgeois, board-certified veterinary dermatologist, skin nerd, and your go-to guide for everything itchy, smelly, and inflamed. I'm here to take the itch out of your day and make derm more fun than frustrating. Grab your microscope and let's focus in. Well, welcome to another episode of the Derm Vet podcast. He is back with a really wonderful background. Do you like that intro? He's back. He is back with, I was already complimenting his wonderful, I love the Southwest 5 background. No, it's Dr. Tom Lewis, who, I don't know if I've told you this yet, but I was telling someone this recently. So you were on the podcast almost exactly a year ago, right? We were talking about the release of Zenrelia. And I've always known of you. I think I introduced myself to you probably like 20 times because I'd be like, oh, I don't know if you're like, Ashley, I know who you are. But I told someone recently, because we have had the opportunity in the last year to get to know each other more and get to hang out at some of these events, that I think you're one of my like top new derm friendship like favorites this year.
Oh, don't start making me cry before we start
Yeah,
this.
it's such an emotional
Thank you for
podcast.
such kind words.
Such an emotional No, it's just been really lovely. I've
Thank
always
you.
known how kind you are, but I've also gotten to know how funny you are, which is kind of always really interesting to get to know people more. No, Dr. Tom Lewis, who is with D4A, as we lovingly call it in the derm community, but for all of you, dermatology for animals in the Phoenix, Arizona area, thank you so much for agreeing to be back on the podcast.
You're very welcome. I'm delighted to be here. I like talking with you about this.
Yeah, and I think we both have a very similar approach, right? Like we as dermatologists understand allergies are hard, but we also want to help a lot of pets and realize how this is a very difficult disease that actually affects quality of life a lot. And I think sometimes we overlook that. It's allergies, it's itch, it's not maybe life threatening, but we know that how itchy these pets get, how miserable the infections, that it's chronic and often lifelong, really has an impact on our clients and the pets themselves.
And the bond between those people and their dog, and it's so true. And then the rise of resistant staph,
Yeah.
and we could go on and on.
All
Yes.
the multi-drug resistant Pseudomonas all the things that we unfortunately have to manage, more and more as we see these things happen. So when you were on last year, Zenrelia had just been released and you had been involved in the studies. And I had had some minimal use, but not really a lot of use with it yet. Now we've had the medication in the United States for about a year. But the reason we wanted to hop on together is maybe to talk a little bit about that experience, but really to talk about the exciting news that the box label warning that exists in the United States has changed like last week as at the time of this
Yes.
recording. So very new. Can you let the listeners know what has changed within that label warning?
Yes, I can, and maybe even just offer a touch of background about the label. The original label released a year ago, when Zenrelia was released, talked about possible fatal reactions and withholding drug before a month before vaccinating and withholding a month afterwards. And the label was generated because during the vaccine response study, which was done during COVID, it involved 16 research beagle puppies that were supposed to be free of all infection, and these were 10-month-old dogs. And the problem was they had infections. They were sick at the time. Even the control dogs, half the dogs were control patients, and they became ill with vomiting and diarrhea. The other half of the other 8 dogs were on 3 times the dose of Zenrelia. Well, 2 of the dogs became so ill that they were euthanized, and tissue from their liver, they realized these dogs also had adenovirus 1, infectious hepatitis. But this was after the fact. This was after that study had closed, before that was determined. At the time of the study, they knew that they did diagnose coccidiosis and treated them twice for that. And again, even the control dogs were ill. And they assumed that was the only problem. And we know that coccidiosis alone can suppress an immune response. And the control dogs in that study had suppressed T lymphocytes as well. So it was just a conundrum of a study, and it's not, I'm asked oftentimes, why didn't they just stop it? Because, it's not like you can just order 16 more SPF Beagles on Amazon Prime. It takes a long time to even get these dogs for these studies, and so they being Elanco determined or decided that they would launch despite this warning. Um, and just because it was such an amazing drug and they wanted to get it out. And really the only restriction, even following the label, was you might have to withhold the drug for a 2 months, 1 month before a vaccine, 1 month after. So that's why the label talked about possible fatal reactions, because the FDA at the time was concerned that adenovirus 2 maybe had mutated into adenovirus 1, since it's adenovirus 2 that was in the vaccine. But Elanco has been working with FDA, and FDA has been responsive. And so, as of a week and a half ago, the FDA did change the warning to strike the wording about possible fatal reactions or vaccine induced disease. Those words are no longer on the label. And the primary box warning now, in essence, says recommends to withhold Zenrelia 1 month before, 1 month afterwards.
And yeah, so going back to the background is super important. Obviously, seeing the change being made within a year is a pretty remarkable thing because often box label warnings, right, are kind of known for that's it. Like they're
Forever.
there
Yeah.
forever. So it's
Yes.
interesting just to see even the flexibility within a year, which probably unfortunately goes to show I think conundrum's a good word. Some of the conundrum that happened with that particular study. And my understanding too, we are both independent dermatologists, so we are not like within the company itself. But from my understanding as well, if you start a study that's meant to put a product through, and then you just stop it, like that also could end up being a big issue as far as not only when the drug gets released, but label warnings, because clearly we shouldn't be starting studies and just stopping them because they don't go the way we want, right? Like, we have to be really
It's
thoughtful
so
of
true.
it's not that easy.
We're told it would have been a huge red flag. And to be candid, we would not have Zenrelia today if that's what Elanco had decided to do. And I have hundreds of patients whose quality of life would have been worse this last 12 months.
Yeah. I mean, it's just
Mhm.
I think that's why I don't do research myself because it is very complicated. Thank goodness for the people who do it, and it's just more involved than we really probably even understand as clinicians. So you brought up the point, so the adenovirus and the conversion, so the more data that's been put forward, now we know that's not a concern, which is awesome because right, because who wants to have a label that has fatal induced
Oh,
immunity? I mean, that's a
yes,
really scary thing, and, for our clients, for us as clinicians, of course, that's something that we, um, have concern about, just, regardless of how it got there, it just never makes anyone feel comfortable to have that on a label. So
correct.
yeah, so then the question comes, right? So then as we got this news, like the labels change, then the question came around too about, okay, so if the box label warning, and let's also jump into this real quick. That is just the United States. Can you speak to that a little bit? Because we do have lots of
Yes,
listeners in other parts of the world of the podcast. So I just want to be really transparent. This is just a box label warning that exists in the United States where Zenrelia is available. Is that correct?
that's right. So if you're a veterinarian practicing in Brazil or Canada or Europe or Japan, this is not even an issue for you. And And because of that, there are dogs being vaccinated every minute around this globe who are on Zenrelia, who are being vaccinated, who are having adequate responses without adverse reactions. And it's just frustrating that the label, which is, as a general practitioner, when you see the label, I understand the apprehension. But the medication works so well. It's just worth it to work through it, to coach your clients so that they can still follow the label advice and get comfort for most of the year.
And let's talk a little bit. So yeah, I did some lecturing in Canada, and they just have like a caution. It's not an actual label
Yes.
warning. And it was easier to talk kind of through that because I do think we get in a really difficult spot when we blanket statement anything, right? So I've had
Yeah,
cases, to your point, that are like 12 years old, and this is literally they all can respond to medications differently, but this has literally been the medication that has provided an amazing quality of life. Maybe we view that a bit different than a dog. I mean, it's not labeled till they're a year of age or older anyway, right? But maybe a young dog, or to
right.
your point, a dog who's going through a GI parasite issue that we probably shouldn't be vaccinating anyway, because the studies show that they literally have a reduced Th2 immune response just from the sake of having GI parasites. So it's really thinking of it through like a clinician, just like, is this pet healthy anyway? Also, not negating how life altering having a dog with atopic dermatitis can be. Like, how uncomfortable they are, if this is truly the thing that's providing relief and comfort. So I think it just, of course, we want to be thoughtful of the cautions that are there, but I also think we get in trouble when we don't think of the quality of life of that patient and look at all of them as individuals themselves.
Yes, and you use the word clinicians, and so we clinicians get to use and look at the evidence-based medicine. And there have been published studies now. There's published studies in Veterinary Dermatology Journal, which are open access, talking about the one study looked at 68 dogs, and a third got a placebo, a third got 3 times the dose of Zenrelia, and another third got the labeled dose of Zenrelia. These were 10-month-old dogs, but they were receiving a booster, and they did not have hepatitis and coccidiosis. And every single one of the dogs on the labeled dose of Zenrelia had 100% uh, conversion on their titers after being vaccinated. So it, it's comforting, I hope, to recognize that dogs on Zenrelia, if they're vaccinated, can still have an adequate response. That's what the data shows us. And so that doesn't change the label, but I hope it helps a veterinarian, in those special cases where coming off drug is maybe not an option for the as far as the dog's quality of life. I hope that helps reassure that clinician.
Yeah, and that's something too where, to me, I look at every patient as an individual. And as a person who doesn't get vaccines, I'm very respectful of whatever the general practitioner wants to do, right? Like
Yeah,
we're both very
yeah,
respectful. We are not we are specialists that do not get vaccines. So in the end, I always go by whatever the primary vet wants to do is when giving the vaccine, I'll be comfortable with that. But when I get vets who call me and discuss it, again, we look at the case, we look at,
yeah,
are there alternative options that make sense with that
right.
label, or is there literally not an alternative option that makes sense for that patient? And for many of our difficult derm disasters, right, there might not be, and being off for 2 months could be detrimental to all the other things that you were mentioning, MRSP, bad pyodermas, malassezia, dermatitis, really bad ear infections, destruction of trust in us as the veterinarian. I think that's a very real thing. There's a lot of alternative sources of information out there. And so I just have a really candid conversation with my owners. Yeah, I don't there is a label. We talk about it, right? And we talk about what journey their pet's been on, and then we talk about, the age and the new studies and go through all of that because I no one's trying to not be forthright and be upfront. Like, yeah, of course, this exists. Let's talk about why
Absolutely.
it's there. Let's talk about your individual pet and let's talk about the best option. And most of my clients have been very like, that makes sense, very understanding. We go over the new study and again, make an individual option. But there's a lot of my pets where truly we have tried everything else. And 2 months off of that medication, if it really has been the thing that controls them, could actually be very difficult. It could take us it's not like all of a sudden 2 months later you restart the med, they're good to go, right? Like in those 2 months, if they have flared, then all of a sudden we're talking about maybe another month. What if it's a resistant pyoderma? Like, so we could be talking about a few months in an individual patient that really struggles.
Uh, it seems like every day I see an example that supports what you just said.
Yeah.
And yeah, right,
Yeah, the flares don't just turn off, like, when you start the allergy meds, and we see that even as clinicians, right? Like, we manage these cases, they're doing great, that doesn't mean they'll never flare ever again. So
right.
then we're always behind the 8 ball, so then if we kind of take away the thing that is controlling them, if it makes sense for that patient, then I just think we have to be really thoughtful of that. I guess it's just not easy. right? Like, that's what I think we have to realize. It is not simple either way, and that's why I think it's really important for us to be updated on the literature, know these new label claims that are coming out, and really look at that individual patient as just that. It's an individual and, like, what makes sense for them, just like we can't say every dog will do great on this drug versus this drug for allergies. Like, it really does depend, which I know is really disheartening as a general practitioner. They hate that answer, but it's so true.
You smart kids are talking about all these molecular endotypes, and I had to go look all that up, that how the different cytokines are involved, and isn't it remarkable, or maybe not remarkable, but it certainly is intriguing how one patient will just do fabulous with one drug, but the next, a dog comes in who's just not red at all, but he's really itchy, and Cytopoint doesn't touch it, but it should have.
Yeah. Oh, yeah.
And
I
mhm.
tell owners that all the time. I'm like, "This is what I think makes sense as a starting point, but they're all little individuals we have to figure out." And so that's why we recheck them frequently. That's why we're making sure they're responding the way that we want them to respond. I wish it was that simple that I always had the answer right the first time. But, I mean, you're a practitioner
That's
longer
why
than me, you probably know
as
that.
old timers call it, that's why we call it practice.
Right. Yeah, it's true, and same for us even as specialists. I have been dead wrong,
Mhm,
right? I'm like, "Man, I
mhm.
really thought that was the right drug to start with," but, I mean, the body is the body, and it's just not that straightforward. So you've talked about the new booster studies, which is really important to know. So that is published. It was presented at an infectious disease um, conference last year, and then it has been published in Vet Derm. So I can put that in the comments so
Okay.
people can see, because I do think that's really important to be aware of the updated literature. So if you're listening to the podcast, I'll put it in the show notes. Also put it on the YouTube show notes too, so that you can evaluate the study Dr. Lewis is talking about. So now that you've had this medication now clinically beyond the studies that you already had experience with, now we've had it for, a year here. So the last question I want to ask is your comfort with long-term use. We do see a lot of atopic dogs who are non-seasonal. And so the question is, what is your comfort level based on your clinical experience of using this consistently long term, if especially for these cases where it's truly providing a great quality of life?
I estimate I've now treated over 600 dogs with
Whoa.
Zenrelia. Um, I don't even think I'm the there's I know of others who have done more. Um, Part of that's just because 'cause I'm a little bit lazy at this point in my life, but anyway, um, and I am I am very comfortable with the drug, and, may I share where I have probably seen the biggest surprise? Because when we were doing the clinical trials several years ago, dogs had to have these certain levels of itch. They couldn't have infections. They couldn't have all the secondary granulomatous disease that so many of us see as a consequence of chronic allergy. So when I started using Zenrelia a year ago for these allergic atopic patients with bad ears and bad feet and pododermatitis and deep infection, I was I was surprised to see how many of these patients, they did better on Zenrelia than they had been doing on steroids, with cyclosporin, and sometimes with Apoquel, all 3 drugs. I have patient after patient who has responded more favorably to the one drug at the labeled dose versus the off-label combinations I was having to use prior. That's that that's why I'm here today, because this is an amazing drug, and we need to be help veterinarians become confident and assured that it's going to help the majority of their patients. It certainly has not helped 100%. No drug does yet. I tell my young uh, dermatology residents, don't worry, we're still going to need you. But it is an amazing drug, and I can't. I have, and I've not really seen a a good response where it has worn off over the time of a year. Um, and I have yet to see a patient who had a neutropenia that was clinical where we had to stop the drug. I've just not seen that. I've seen a few patients where there was a slight neutropenia. We made a slight adjustment in the dose and they responded well. Um, I've had patients where there was no second choice. They insisted on getting their vaccines because without the vaccines, they couldn't go for boarding and daycare, and those patients were fine. So I have a lot of positive experience at this point with Zenrelia.
Yeah, I think it's about coming through yeah, and I've had plenty of dogs who have done I've not done 600 dogs, but I have many dogs, that truly, like, it has been really, extremely helpful, provided a quality of life. Of course, yes, I have dogs where we were ready to start it, we started, and they did not do as well as we had hoped for.
Yeah,
I mean,
yeah,
again, in the practice of medicine, we have to get comfortable
yeah.
with that. And it is such a overused term, but I'm gonna go ahead and throw it out there. I will just take all the tools in the toolbox. Like, I think whenever we just want to say, "Oh, I'm only gonna use this med, I'm only gonna use this med," in a chronic, inflammatory, pruritic, lifelong disease, to your point, that has many endotypes and phenotypes that we probably don't even know about all of them at this point, right?
Right,
Like, I
right,
think in 10
right.
years, we're gonna have different discussions, right? Imagine when JAK inhibitors came out and we were like, "Oh, cytokines are really important." Like, we knew they were, but when I started, we weren't talking about IL-31, and now it's like all we talk about. So to that degree, we just need to get comfortable in what we want to hopefully provide comfort with is knowing that this is a difficult disease. We're in a difficult spot with this disease anyway. We just want to get comfortable being able to provide a good quality of life for these patients. And when the next drug comes out, guess what? I'll be using that one. And when the next drug comes out, I'll be using that one. And I'm going to have successes and failures with all of these medications. But it's just really important to realize how these meds work, why we get the labels we do, the literature that comes behind it, so that we can provide good quality of life for these dogs. And it's a common disease we know general practitioners are seeing often. So
Yeah,
it's not a rarity that you can send every single one of them to a dermatologist. You
no.
guys are gonna have to manage this, so we wanna provide comfort of knowing, the ins and outs and provide clarity on this stuff for you. And with that yeah, I see a lot of nodding, you feel good about that?
Yeah, I couldn't have said it better.
Yeah, yeah, I mean, it's just we're really passionate about helping pets, and this is a difficult disease, and we know they can't all see dermatologists, so
Right.
it's important. With that, Doctor Lewis, always, always a pleasure with your wonderful
Thank you.
background and your, kindness and funny. No, I really appreciate it. I did get to annoy him before we got on. He goes, "How's your day?" And I go, "Well, it's Taylor Swift release day, so I'm doing pretty good." Uh, he didn't share that passion, though.
But I did know who Taylor Swift was.
Listen, and you do still have the in on me. Every time I see Jimmy Eat World or hear a song now, I send it to you 'cause I know
Okay.
you treated
Yes,
his
yes, yes, yes.
dad's dog.
No, his dad is a veterinarian
Oh, even I love
and
him
was
more.
one of my probably one of the 3 most important mentors for me.
That's amazing. Yeah, I
Yeah.
love all these, like, ins and outs. I just saw them, like, a month ago, and it was super hot here, and he was, like, sweating profusely, and I was like, "Come on, you're from Arizona." But no, it was very,
You've
very
trained for this.
yeah, it was very hot. No, but I really appreciate your time. I know how much you care. I know how important it is to you to get the message out just so we can help more pets. So I appreciate your time today on the Derm Vet podcast.
You're welcome, and thank you for getting this together.